So welcome everybody. It's always a big pleasure to have you all following us. I give directly the floor to Rachele Donini, who is the chair today, as she was also for the last webinar. Let's start. Rachele, the floor is yours.
Thank you, Marika. Welcome everybody from all over the world, from also Australia. And so nice to have you all here. So yes, today our webinar is about young people and drug use. How can we keep them safe? It is in some way a follow-up, let's say, from the previous webinar that we had last month, that it was about teens and psychoactive substances, what to do. So now today we are focusing on those adolescents that have already started on using or experimenting use of substances. And we want to understand together with our speakers, how can we keep them safe? So you are encouraged to ask questions in the Q&A session, and the last half hour we will answer to your questions. We will have three different sessions where all our speakers will answer according to their specific understanding and knowledge. So I would like to introduce Nora Vitali. Nora Vitali is a clinical psychologist in systemic therapy. And she's been working for IMPULS, a non-profit organization based in Luxembourg in the last 4 years. And Nakisa Kendall is also a colleague of hers working in IMPULS based in Luxembourg. She's a psychologist. Nakisa is specialized in cognitive neuropsychology and has been working with IMPULS since September 2022. Then we have Helena Valente. Helena is a psychologist. She has been working in Portugal from the University of Porto. Her research focuses on the impact of harm reduction services with a special emphasis on drug checking. And then we have Owen Bowden-Jones. Owen is a consultant in addiction psychiatrist at the CNWL Club Drug Clinic based in London. He was the founder of CNWL Club Drug Clinic, which is an innovative service offering treatment for emerging drug problems. And he is particularly interested in education, and he contributes widely to the public debate on substance use and has authored The Drug Conversation, a book for parents. So I think we have some very knowledgeable and important speakers that will help us really tackle this important question about what to do to help adolescents to keep safe. So now I pass the question, the floor to Nora to answer the first question we have, minors and drugs, how to address adolescents and substance use. A case study from Luxembourg and the organization, non-profit organization, IMPULS. So Nora and Nakisa, yes. The floor is yours.
Hello, everybody. Yes, thank you that we can be here. And we will, do we have the PowerPoint?
Yeah, you just press next.
Well, can I see the PowerPoint?
Do you see it?
No.
It's already, you don't see the PowerPoint?
No.
It's not sharing?
I think it has to do, we can see it. It has to do with your impulse.
Yeah,
your
okay.
settings.
Okay, I'm sorry, we can't see it, but I will. I'm sorry. Okay, so hello everybody. We will, we will present you and talk about the organization IMPULS. IMPULS is the youth protection service who's offering social and therapeutic assistance to young people aged 13 to 21. It's also for their families and the institutions concerned, boarding schools and normal schools. Everybody who's confronted with the use of legal and illegal psychoactive substances. IMPULS is it's an organization. It's free. The consultations are free. It's founded by the Health Ministry. Okay, and we are especially working under the youth protection law. Okay, so most of the young people who are sent to us is by law for minors. When they are in danger, so there's a youth protection law. So they are sent to IMPULS. They are addressed to IMPULS that we can offer a help, and we offer different. We have different offers. It's in prevention, early intervention, individual therapy, and/or family therapy, and our option program. And Nakisa will tell you a little bit more in detail what we can offer.
And we'll see if we can. Okay, there we go. So one of our first things we can offer to our clients is universal prevention. We have a prevention team working in Strassen with a group of 2 agents of prevention. They often work to build an intervention guide for prevention for different high schools and institutions here in Luxembourg that work with young people. So we're often working with high schools here in Luxembourg that either come to us or we go to them and to devise this interventional program. We also offer training for professionals here in Luxembourg, not only mental health professionals in schools, but also professionals of even just teachers for maths or things like that who want to know more about drug consumption in young people. We also offer coaching and supervision of teams in schools and other organizations, such as boarding schools, for example, or after-school programs and such. We also offer conferences, psychoeducational conferences that we teach professionals, young people, and parents about drug consumption. We also offer roundtables, open talks, questions and answering style formats. We often work with the CEPAS here in Luxembourg. Each school has a group of professionals such as psychologists, counselors, and social assistants. We're also working with them to help them learn about the signs of consumption in young people. We also offer 3 programs called Choice and Prost. So Choice is a psychoeducational program talking about the use of cannabis. We also offer that for 18+, so people above the age of 18. And we also offer Prost, which is a psychoeducational program about alcohol. Okay. We also offer something called selective prevention, which is our service thérapeutique, which is our therapeutic program. We have a team of psychologists in Etzelbruck, Esch, so the south and the north and the city center. We offer outpatient care. So we do consultations one-to-one with our clients. We also do family therapy on a systemic level, which is why a lot of our psychologists here are trained in systemic therapy. We also offer parental coaching. So if parents have some questions and want to know a bit more about how to handle the cases, they can also come to us, give us a ring, and we talk to them in a compassionate manner. We also have come up with creative projects for young people to get them together and to kind of put their energy through to in a creative manner, such as music or the arts. We also here provide, as part of the therapeutic team, we also provide training and supervision for other professionals in the field as well. Our main age group is between 13 and 21, but it can vary from time to time based on specific cases. We're also working very in close link with the judicial sector, so with the judge and the courts and things like that, in order to help young people who have been confronted with the law or any sort of judicial sector. We're also offering Prost and Choice for these age groups as well. So these are groups up to 10 kids coming together in their language, such as Luxembourgish, French, and we offer in English now as well. Our last type of prevention, which Nora mentioned before, is called option, which is our indicated prevention. This includes long-term treatment and a bit short-term treatment as well. It's accessible to anyone wishing to follow a therapeutic treatment aimed primarily at abstinence. So this is for all age groups, and it's mainly working towards building the family and social environment around the client. And it involves as well in the psychosocial sector as well. So what it comprises of is working on sending the client to a stationary treatment abroad. And it works on intensifying an intensive monitoring and motivational work before the treatment. And then while they're away at their treatment, one of our psychologists on our option team will communicate with the therapeutic community or the clinic in that country. We also organize all care prior, during, and afterwards, financially, and also in terms of the administration as well. We keep a regular contact, of course, with the social actors involved, and we accompany them, if they're minors, to the therapy itself, if needed. And of course, parents are involved in the entire process. We also, post-therapy, will involve the parents and the families long-term afterwards in order to keep the patient regularly followed up in order to make sure that they are keeping comfortable post-therapy as well. As we know, it can be difficult to come out of treatment and suffer a bit from coming out of that bubble for so long.
Okay. Yeah, thank you, Nakisa. Very good, presented the different offers. Yeah, here you can see that we have in the north, have an Attelburg, we have an office, we have a central Luxembourg city, we have an office in the south, we have an office now because there's a lot of, we have a lot of clients, a lot of young people that are coming to us, they need help, and we have then our prevention office, and we work under our, how to say this, our it's Solina also.
So we have a foundation that we work underneath.
Yes, this foundation Solidarity. Okay. Yeah, and here you can see people we.
So our team is relatively big, and it's divided between the 3 different offices across the country.
Yes. Okay, but thank you for listening to us. And if you have questions, we can respond to them afterwards. Thank you.
Thank you very much.
Okay, thank you, Nora and Nakisa. And now, Helena, would you like to address this question? School is over. The summer festival season is open. What can we do to keep young people safe?
Hello, Raquel. Thank you for the presentation. Thank you, Alessandra and Marika, for the invitation. And let me see if my PowerPoint. Is there something happening? Okay, thank you very much. So I was given this question. It wasn't exactly this, but I changed a little bit the safe for well-being. I took the chance and changed it, and this is going to be the motto that I'm going to try and answer with a hands-on approach from Kosmicare during my presentation. I'm just going to begin by giving you just really some brief background on why festivals can be relevant intervention settings. And most of us know that festivals, raves, dance music events have always worked as contexts of sociability, pleasure-seeking, and transgression for a lot of young people, and drugs have always played an important role in a way of producing and enhancing these experiences. This liminal quality of these settings, of festivals, really creates an interruption in people's everyday life, in their routine. It facilitates their connection with other people, but it also facilitates this intense experiences and transgression. Quickly, research and epidemiological research around these settings sort of realized that drug use in these settings were higher than in that people coming to nightlife events or festivals had higher drug use levels and higher prevalences than the general population. And this high levels of drug use combined with other situations like we can see there, for example, festivals lasting several days with extreme temperatures, crowds, a lack of sleep. This could promote a lot of drug-related or non-related emergencies. So it was a relevant context to intervene. And whether it's public authorities or civil society organizations decided to allocate resources to this type of settings because it seemed relevant. And you have a wide variety of interventions in these settings. I'm not going to focus on that, but we have some more towards the control of the use of the substances, trying to prevent their use, like the strip search, the dogs, the detecting and confiscating substances at the entrances of festivals. But we've already seen that this type of intervention might actually have pernicious effects. And then you have also environmental strategies that provide resting areas, water, food, ventilation, staff training, and then you have more the harm reduction settings, which is what I'm going to focus more on, which are also a way of preventing these potential harms and emergencies, but many of them were born from a bottom-up perspective, also from collectives of people using drugs. And they try to assume an active role, promoting the safety, but also the well-being of their communities, and looking for a more non-moralizing and caring solution. And this is, I think it's at the core of what I'll try to share with you. I'm sorry, I'm still not, okay. So I'm going to share with you a practical example from the association that I am a part of, Kosmicare. And I'm going to divide my presentation in 3 phases. What we do before the festival, during the festival, and afterwards. It's a bit of a false division, as you will see, but I think it will help to understand. I'm just going to very briefly share with you what Kosmicare is. We're an NGO born of the will to inspire change in drug policies, promote the well-being and empowerment of people that use drugs, their families, and their communities. And we are based on these 3 pillars. We always try to do needs assessment and research that can inform our practice and intervention. And then based on what we see, try to advocate for more humane and fair drug policies. Some of the things that we accept and that are important in our intervention is that the use of drugs is inscribed in our behavioral repertoire. It's a behavior that a lot of humans have. We understand it's a very complex phenomenon, and it's based on a continuum from abstinence to extremely problematic or heavy drug use, as you wish to call it. But people can be situated within this continuum, and this is relevant for the type of information that we do. The main criteria for the success of our interventions is the well-being and the quality of life of the people that work with us. We are also free of moral judgments and coercion, and we are developing gender-sensitive responses and always trying to discuss the intersection of drug use, racial inequality, gender, to guarantee that our interventions are representative and are based on social justice. And I will give you some examples of what we do, how we prepare a festival. We have a drop-in center in the city of Lisbon that is always open for people, and we invest a lot on online intervention. So we provide a lot of information to prepare people, for example, for this summer season. I bring you here a photo of a survival guide that we did for New Year's Eve, but we also do this for festivals, helping people plan their experience and what are the difficulties or the challenges that they might face in a festival so that they can prepare ahead. And this is just some examples of the information you provide. Here is some information about LSD. All the harm reduction materials are also available at our drop-in center so that people can prepare ahead, like I was saying. Another thing that we offer previously and always at our drop-in center in Lisbon is a drug checking service, allowing people to submit their drug samples for chemical analysis and to receive targeted information and specialized counseling. The main objective of our service is to promote the adoption of safer drug use practices and patterns in the people that come and visit us. But this also gives us more information about the informal drug market and allows us to give it targeted information. For example, to have alerts, to have awareness campaigns, to have targeted information to people and the broader public. What we also see is that drug checking services are considered trustworthy by the people that visit us and by recreational drug users in general. So it seems that it's more effective to have harm reduction responses that include drug checking than harm reduction responses that don't. Also, what we see is that here we're reaching a group of people that usually Some of them are in their early stages, beginning their drug use. Others, what happens is that they are experienced users, but have never reached another services regarding their drug use. So we're reaching a particularly set of people. What we've seen from our data from 2022 is that last year we contacted about 16,000 people, and of those, 72% have never reached any other social or health services which was drug related. So this is relevant data for us. I'm sorry, I'm still struggling a bit with the PowerPoint. So this is drug checking information that we share with people. We also do peer and staff training before the festivals. What happens is we have quite a large team of peers, and we train them well before the festival season starts, so they are prepared to deal with the situations that we encounter in festivals. And peer education is one of our basic pillars. We try to include people that identify with our mission so that they can come and work with us. And we see that information passed by peers and counseling done by peers seems to work much better in a festival setting where people can identify with the person that it's providing the information. What we also prepare is our Psycare and our Lilac Care areas that we have in the festivals, and I will explain to you, but we start working with event organizers early on. We do workshops and capacitation activities that can support, whether it's festivals, clubs, municipalities, to develop protocols that can raise awareness, prevent, and create responses to discrimination, sexist violence, and psychological crisis, which usually is due to drug use, but might be to other things, for example, anxiety to be in such a crowded place and such an extreme experiences. We also do staff training to promote practices of care within the festivals and to promote the collaboration between the different welfare teams that are in the field, because we work with firefighters, with medical emergency. Some festivals have stewards that are patrolling the grounds of the festival. We can also train them to be aware of how to identify certain situations. So this is valuable to prepare a festival. During the festival, one of the things is location. Location is key for us. We have to choose a really good spot where people will know that they can find us. We always work with the event organizers to make sure that we're very well signed on the map. For the different festivals that, for example, have social media, that have apps working, that have websites, we tend to also write pieces on harm reduction that they can publish on their own spaces, so that people, when they're searching for the festival, they're already aware that Kosmicare is going to be there and it's going to have certain services available, so they can know how can they resort to us. And another thing that we do for the festivals that have this available, a lot of festivals have talks, have debates. We always try on the first day to have a space where we can go and present our services and the type of things that we do, to make sure that we reach the largest number of people that we can, so that in the beginning of the festival, people already know what's happening and they already have some cues on how to work with this. Then we have different spaces at the festival. We have the info hub and drug checking, where we have a safe, caring, and inclusive space where people can have harm reduction materials, information, resting space. They have some brief motivational interventions and drug checking. So this is one of our spaces you see here. This is the line for drug checking. So we have a lot of people coming to our drug checking service. And usually, unfortunately, we can never provide analysis to everyone that wants. This is an issue that I think it's interesting to discuss, accessibility. So it's important to have more resources, but it's also important to think of more creative ways of how to disseminate information. We have just recently submitted a paper on the idea of the designated tester, a person that tests for a group and that the group chooses, because usually people buy together, and this person can work also as a multiplier agent of information. This works really well. We see this from the users themselves, and we have to think of ways of disseminating the information to people that can't or won't access the service. This is just a photo of our lab in one of the festivals. This is a photo of an alert that we had to publish in another festival. Whenever we need to publish alerts, if the festival has an app or everything, we're going to do that. If not, what happens is we try to put it in really visible spots so that everyone can see it and can come and ask us questions, even if they don't want to test. I'm just going to share very briefly some results of the behavioral, of the decision making after receiving the test results. We've been doing some research about this, and you can see that when people get an unexpected result, they tend not to use the substance or use a smaller dose. And even people that got the expected result tend to actually change their behavior and even avoid mixers or take less. So we see that drug checking seems to have a very interesting impact on behavior change. We also have our Psycare and Lilac Care spaces, like I told you before. The Psycare space has a specialized team that supports people undergoing challenging psychological experiences that are usually drug-related. We support the referral and the evacuation to mental health services outside the event. And we also facilitate the contact with family and friends, sometimes people that are in other countries. We can facilitate with the embassies, all of this work to make sure that people get to their homes safe. Also, the Lilac Care team, it's not a different space, it's the same, but it's specialized team to deal with situations of discrimination, microaggression, sexual harassment, or even other forms of sexual violence. Here we also have referencing to specialized services outside the festival. We can help people if they don't want to go to services, but leave the festival. So we create a space where people can feel safer. And this is a photo of of one of those spaces that we set in the festivals. And then just to finish, after the festival, we still have our drop-in center open, so people can always come. We have a psychological support and harm reduction counseling. It's a confidential space. It can be online or face-to-face with a psychologist and 2 psychiatrists using the harm reduction principles. And here we can help people integrate difficult experiences that they might have lived in a festival or at home, but that they need to integrate. If they need to manage their drug use or even stop using, if that's their wish. And we can also help them prepare for an experience that they think they're going to have, they want to have, but they're not sure how to do it. So this is one of the posters from our service. And thank you, and I'm available for any questions that you might have at the end.
Thank you very much, Helena. That was very clear. And I also wanted all you to know that EMCDDA Director Alexis Gostiel is online, and he will be happy to add some final reflections at the end. So we can proceed with the third question, the drug conversation. So a doctor's perspective on young people using drugs. So Owen, the floor is yours.
Thank you very much. Let's just wait for this to... Just waiting for the slides to load.
You should have control already, Owen.
Okay.
Yeah.
Seem to want to move ahead. There we go. Okay. So, well, thank you very much for inviting me. I'm going to talk primarily about parents, and I'm going to base that on various sort of research and evidence I've gained while working at the Club Drug Clinic in London. And I'm going to talk really about 2 groups of parents who I meet. So I meet parents whose child has not yet used any drugs. And those parents are very keen to gain good information about drug use and to educate themselves, particularly about the new emerging drugs that their children may come across, for example, at festivals, as we were just hearing about. And then the second group of parents I come across are parents who have children who are using drugs, or the parents suspect they are. And these parents tend to be quite worried. They're often not sure what to do, and they're urgently seeking advice and knowledge about drug use. I was commissioned to write a book for parents, And when I was writing it, I wanted to sort of think about what different parent groups, what these two groups would need. So clearly the book needed to include good quality, accessible information about drugs and about people who use those drugs. I wanted to try and answer the questions that I get asked so many times by parents, and I tend to get asked sort of the same questions, and I wanted to make sure those were included. I wanted to make sure that the book included case studies and examples from my experience and this experience within the clinic. But most importantly, I wanted to try and improve communication and give some pointers to parents about how to have a conversation with their child around drug use. Now, you might think, well, why do parents need to talk to their children about drugs? And actually, many parents will say, listen, I feel really uncomfortable having that conversation. I'd much rather the school does it. But there are a few really good reasons why parents should get involved in this. The first is that research shows that actually parents' views really do matter to children, and they are able to give information to children that children actually will listen to. And that research shows that right into mid-teens and beyond, actually parental views come out very highly rated, quite surprisingly, in fact, to children. Now, that's important because information influences choices people make. And as we've heard from the first two presentations, you know, getting the information out there, getting really good quality information is absolutely key to reducing harm. And there is a huge amount of misinformation about drug use available. Many children learn about drugs, learn about different types of drugs. The information is just wrong. And that's a very risky thing for a child. Another really important reason to have this conversation is to destigmatize the issue. Now, this may vary from country to country. Of course, in Portugal, you've got different drug laws to in the UK. But in the UK, it's still, for many families, quite a stigmatized conversation to talk about drug use. And actually, my advice to parents is that they try and have this conversation early with their child so that that child understands that this is a topic that parents are happy to have a conversation about. And in destigmatizing it, it means if there's a problem later, then the child is more likely to come and have a conversation with their parent. Now, when I was writing this book, I spoke to lots and lots of parents, and they said, listen, what we really want to know is the do's and the don'ts of having conversations. So tell us what we should be doing. Now, it's a slightly difficult thing to do because, of course, parents know their children better than anybody else, and they'll have, you know, an idea of what might work best. But I sort of came to a list of things that I thought were important. The first is try not to cram this all into a single conversation. Try and make it something that evolves as a conversation over many meetings with your child. The second was to set the scene. So quite often I have parents who will just sit their child down and say, right, we need to talk about drugs. And their child tends to look very alarmed and then sort of find an excuse to leave the room as soon as possible. So setting the scene and letting the child know that there's an important topic that the parent wants to talk about, that is a much better way of doing it. Think about whether one or both parents should be there. Some parents don't live together, and it may be quite important to have both parents, if they don't live together, at that conversation, just to show that there's a sort of agreement between the parents on it. Be clear what the conversation is about. Many parents come and report to me that they started off having a conversation about drugs, but within 2 minutes they were asking their child what they wanted for dinner. And that's usually because they felt unclear and unsure about what to say. And so the conversation rapidly drifted to safer territory. Be consistent, keep calm, and listen. And listening is perhaps the most important part of this conversation. Don't accuse and don't interrogate. It's very easy to try and have this conversation, and then the moment the child says, oh, well, yes, I have smoked some cannabis, for the parent to totally freak out and start asking 101 questions about it. That's generally not a really good approach. The parent should not claim complete ignorance around drugs, nor pretend to know absolutely everything, because no parent will know everything. And the huge number of new drugs means that, that there's likely to be many things that the parent doesn't know that the child probably does. Make sure you give information, point people in the direction of good quality information. And we've seen some amazing examples already in the first two presentations of where you can find good information. Don't forget to talk about alcohol. Alcohol is the drug that, let's face it, is the most commonly used and can have very harmful consequences for children, particularly obviously when mixed with drugs. Make sure you leave time for questions. Be prepared for the tricky question. Of course, the trickiest question of all a child will ask is, Mum, Dad, have you ever taken drugs? And of course, parents need to prepare and decide what they're going to say for that question, and try to avoid the situation where they look sort of perplexed and caught out. Leave the door open for further talks and make sure you finish with praise. It will have been a very stressful situation for the parent, but it will have been even more stressful for the child who is having to sort of go through the conversation. Now, when to start this conversation? Well, I recommend that people start the conversation before the child is exposed to drugs or people who are using drugs. And for most children, particularly in an age of social media, that will be around the ages of 10 to 12. That will be when they're starting to hear in the playground about drugs, they're being shown things, and that's a really good time to start this conversation. It's also a time when many schools start talking about drugs, even in a quite gentle way. And so again, it's quite a good time to do that. Now, this will of course depend on the maturity of your child. Parents are the best place to judge that. And sometimes it will just feel inappropriately young for some children, but that's what I'm recommending. Now, what should you actually say? So I've talked about how to have the conversation, some of the structures, but what actually should you cover? Well, it depends a bit on the stage your child's at. So if your child's not using any drugs, the really interesting thing about this conversation is to try and understand their landscape. So what does your child know about drugs? Where do they get information from? What's the situation at school? Do they know people who use drugs? Have they seen anything on social media? Sometimes it can be very interesting to use an example. So sometimes people say, well, you know, my favorite pop star or my favorite actor is in rehab for drug problems. And you can say, well, what do you know? That could be a way to open a conversation to start talking about substances. The other thing that's really important is to try and give your child an idea of what their individual vulnerability may be. Now, broadly speaking, you can think about that as genetic. So if you have a family tree that's loaded with people who have had problems with addiction, that's an important factor. Doesn't mean that your child's going to have a drug problem, but it does mean that they have a higher vulnerability to drug harm. And then the mental, physical, and social health of your child at that time is absolutely critical. Many of the children I see are using drugs as a way of self-medicating for distress, be that mental, physical, or social. And so trying to understand the level that your child is experiencing those is important because it is a risk factor for further drug use. And then the second group are, well, if your child is using drugs, so, you know, why? Ask the simple questions. Is it curiosity? Is it because all your friends are doing it? Is it to medicate for some distress that you're experiencing? Does the child want to continue? Are they asking for help to stop and have not known how to do that? Do they know about the risks and how to reduce those? And again, as we've heard from the other speakers, there are excellent tools out there now you can direct your child to try and reduce their risks if they're determined to continue using. Now, a lot of parents ask me, well, how can I tell if my child is using drugs? Now, this might be a bit hard for you to see this slide, but on the one side, I've got the signs of puberty, and then I've got on the other side, the signs of possible drug use. And as you'll see, they're almost identical. And this tends to get parents quite agitated because some parents will see a Bob Marley poster on their child's wall and assume that they've got terrible, terrible drug problems, whereas other parents will be absolutely oblivious to signs that are right under their nose. So I've got some of the physical signs. As you'll see, some of the physical signs of puberty: acne, reduced self-care, poor hygiene, excessive or poor sleep, change in energy levels, irritability, anger. All of these things, of course, are perfectly normal for a child going through puberty. But there are some signs that are perhaps a little more drug specific. So things like sores around the mouth, conjunctivitis from smoking cannabis, obviously injecting marks would be a really concerning one. Self-harm, burning, cutting, that has that would be a significant risk factor to think about. And then too much or too little money compared with what they should have, unexplained deterioration in the school performance, talking about drugs on social media. So there are some things that parents can look out for that might make them think that a drug conversation is important to have. The other question I get asked a lot by parents is, well, where should I take my child to see a specialist? I found some cannabis in their room. Should I take them to see a psychiatrist or, you know, a doctor or a drug specialist? And so what I suggested was that there were some absolutely important things that if their child was experiencing those, it would be important to seek professional help. The first is injecting. So if a young person is injecting, that in my view is a situation where they should absolutely, the parent should try and seek professional help, because it's probably out of the capacity of the parents at that point to manage. The other ones are class A drug use. The child asks for help, suicidal thinking or repeated self-harm, psychosis directly related to drug use or independent, extreme risk-taking, for example, sexual risk-taking or driving while intoxicated, physical violence in the home, an existing mental health problem, or indeed a previous drug or alcohol problem that has re-emerged, a strong family history, genetic history for drug or mental health problems, parents are just unable to communicate with the child, or a rapid deterioration in academic, social, and emotional functioning. Now, I know this is an EMCDDA webinar, but I'm rather cheekily going to put something in on alcohol, because there are two things that I think every parent should make sure their child knows about alcohol. The first is they should make sure their children know about units. I'm always alarmed by how poorly children understand the relative strengths of different types of alcohol. So they'll be glugging down vodka without understanding how much stronger it is than wine or indeed beer. So making sure your child has an understanding of the relative strengths of alcohol is really, really important. And the other thing is how to put a friend into the recovery position. Very sadly, every year, people die from being brought home intoxicated with their friends putting them to bed, not in the recovery position, but lying on their back, and they choke on their vomit and die. And it's completely unavoidable. And making sure that your child knows how to put someone in the recovery position, to put a friend in that position, could save their life. So some final thoughts. Preventing drug use. Start the conversations early. Provide accurate information. And remain vigilant. Interestingly, the research does show that households in which drug use is discouraged, there's less drug use by their children. So in very permissive households where drug use is perhaps not necessarily encouraged, but it is clearly sanctioned, then the drug use is much higher. In terms of managing drug use, is there a problem? As we heard from Kosmicare, many people go to festivals, many children go to festivals, will use drugs, their parents will never know about it. They won't have a harm particularly from it, and that will be that. But is there a problem? And if there is a problem, stay calm, try and understand the underlying problem. What is going on with your child? You know, are they just experimenting, or actually is there something that they're really struggling with? that drug use is somehow beginning to try and ease for them in a sort of self-medicating way. Seek help. So many parents, by the time they come to me, have been struggling with this issue for a long time, really knowing what not to do, and sort of just not knowing where to turn. So I'd really encourage parents, if they're struggling, to seek help, and finally to look after themselves, because it's one of the most stressful things for a parent to have a child who's got a really developing severe drug problem. It's something that stresses parents enormously, and it's important that parents look after each other and look after themselves so they're able to support their child. I'm going to stop there, but I very much look forward to the discussion and any questions on that presentation. So thank you very much for your attention.
Thank you very much, Owen. That was very clear, and many things that you have said, and also the previous speakers did help us understand how to keep our adolescents safe. This was especially by Nakisa and Nora and Helena. And you also showed us how to have a conversation about drugs. And this in some way reminds me of the previous webinar, where you did underline the fact that parents' views are important. They matter to their children. So this is something very helpful, and I take the chance to tell all our participants that if they like to see the recording of the last webinar, you can find it on the EMCDDA website. So now, thank you all of you for this very interesting presentation. We have some questions. Now, for Helena, there's a question: how long do people wait to have the result after they bring their drug sample to check? So at the festival, how long does it take?
Well, it will depend on the technique that we use, but it can be, we always say, depending, it should be half an hour, but sometimes we have to say 1 hour, 2 hours, because it depends on the flux of people, and sometimes it's a lot of people, and we always have a sit down intervention. We talk to the person, so they're quite a while. Because one thing that I really want to stress is that we're not doing quality control for people's drugs. We're providing them with a specialized intervention, and that obviously takes some time. So we usually say about 1 to 2 hours to be on the safe side, but we start testing, for example, before the music starts. Again, giving people some time for them to prepare for the festival and for when they want to start dancing.
Thank you, Helena. And we have a question also for Alexis. How could an early warning system be better coordinated at a European level?
Can you hear me?
Yes, we can, yes. Alexis. Hello.
Good morning, everybody, and thank you for the different presentations. I will not make comment now. I will come back to this later. Well, the thing is, first of all, everything is certainly perfectible, but the early warning system that we operate for 26 years in Europe is unique in the world. And we managed to detect more than 930 substances over the last 26 years. So we have concrete ideas how we can improve in the future, in particular in relation to the new mandate of the EMCDDA that will transform soon itself into the European Union Drugs Agency. One of the new features in the future will be the development of a European drug alert system, and this will encompass all drugs, all substances. So potentially there is certainly room for maneuver. What goes together with that new European drug alert system is also something that is extremely important for me already for the existing agency, is to make sure that the information that we produce is reaching the level where it is the most interesting. And I will not make a long speech, just to illustrate. I know someone whose son is consuming cannabis in Portugal. And one day he comes to see me and said, you know, my son is in the hospital. He's in a full delusional state for 2 weeks. We don't know what to do. He's followed by one of the best psychiatrists in Portugal. And well, he speaks, he explains. And then I say, look, because the guy is not working in the health system, so he knows I'm the head of something on drugs. And well, he explained me that he still has what is remaining from the product consumed. I contacted Kosmicare to know how we could send him there to make the substance tested. And then when I saw him a few days later, he said, well, I spoke with the psychiatrist, and the psychiatrist said it was not necessary. The guy was obviously a bit uncomfortable to circulate with cannabis in his pocket. Still, for me, it's a good illustration that we may have a fantastic drug information system. If we don't manage to reach with the summaries, the emergency rooms, the intensive care units, basically this knowledge is partly useless. It's useful for the alert, but if it is not reaching the psychiatrist or those who are in the emergency room, because clearly the psychiatrist is not stupid, he has not made any mistake, it just doesn't know. And it will be our duty or a possibility for us, together with national drug or national health alert system, and of course in close cooperation with our national focal points, to develop such a system. And of course, we need to further develop this with the drug checking programs and others. But this, I keep the second part for the end of the conclusion. So congratulations for the presentations. They were really interesting.
Thank you, Alexis. And now a question for Owen. There are people asking if you can say something about the technology addiction.
Yeah, that's a really, really important question. I see an increasing problem with young people and pornography. And I have, in the clinic that I'm running, both for younger people and for students, we're seeing really quite dramatic increases in the number of people who are coming forward and saying, I'm addicted to pornography, and that they're presenting with what really would fulfill the criteria for a dependence. We are also seeing people with issues around gaming, and in young people a bit less so about gambling. So I do think that we sort of have to reorientate ourselves with young people and understand. I talked about the drug landscape, but we need to understand the technological landscape within which they inhabit, which will be sort of not that familiar to all the people I can see on this screen. The people who are in their teens will have a completely different understanding of that landscape to the one we have. And we won't necessarily see the risks that they're being exposed to until they start having problems. So whether it's pornography, whether it's gaming, whether it's other things, it's a very important issue that certainly I see as an emerging harm.
So thank you very much, Owen. And now a question for all our speakers. There are many questions about use of drugs as a self-medication, and all of you did address this issue, and mental health services. So what would you say about self-medication and mental health services and use of drugs? Who would like to start?
Okay,
Owen,
I'll start, but then please the others do go ahead. So I'd probably say 80% of the children I see and the young adults I see are self-medicating for emotional distress. It's by far the main reason that people come to see me. No one starts using drugs to have a problem, but actually some people realize that drug use actually gives them a moment of relief from intense distress. And that can be such a powerful psychological experience that it takes them back to it, and then the problem develops. Now, it's not the motivation for everybody. Some people, as I've mentioned in my presentation, have very strong genetic predisposition to drug harms. And that seems to be, in my view, a slightly different mechanism. But certainly the majority of people I see, self-medication is key, because then it means that the work that I do as an addiction psychiatrist is not really so much about drugs. It's actually, the drugs are sort of the signal, but they're a signal for a root problem. And actually that I spend most of my time with young adults thinking about what the root problem is rather than about the drug.
Thank you very much, Owen. I find this interpretation really a key to psychoactive use of substances. Okay, Nakisa and Nora, would you like to address the question?
Yes, we want to, we agree, actually with Owen, also we see the same thing here in Luxembourg. Also most young people are really giving the reason of self-medication. For cannabis, it's really like the relief for stress. They want to be more stressed. And this is also what we want when we have in our group choice. We actually are also talking with the young people, and we are addressing these questions so they can reflect their consumption, and they can see that they are, because they always say, oh, we have no problematic consumption, we are using sometimes, but actually no, they are starting to having a problematic consumption because they are using it to self-medicate. And this is really what we also want to talk with them about it, and to find alternatives to this. And yeah, this is really what we want to address but we also, we have most of young people that come to IMPULS is because of cannabis, because cannabis is still illegal here in Luxembourg. But we also have our program Prost. This is for the alcohol consumption. And I really want also to say that this is really, alcohol is legal. So it's not the same. We always say that we also have to address the dangers of alcohol, because this is not, they always say, yeah, but alcohol is illegal, so it's legal, so it's fine. But well, most of young people also say that they find that alcohol is dangerous. So we also want to say it's really important for parents and also for schools and everybody that you have also to talk about alcohol, and also yeah, this risk of self-medication, that because they find relief actually in the consumption, and they will continue, and then it can become problematic for their health. Yeah. Thank you, Nora, for this perspective. And Helena?
I would just like to add something not very different from what Owen said, but I was thinking that not necessarily at the festivals, because we don't have so much time to dwell on that, but when we have the psychological support and harm reduction, what we see is that obviously a lot of people began just by having pleasure, but a lot of people also do it to, maybe I wouldn't say self-medicate, but actually to promote their well-being. They feel that their experience with the drugs can help them. And what happens is when somehow they feel that things are not going exactly as they wished, or for whatever reason they're not feeling so well, and they look for help, they tend to focus a lot on the drug, because that's what they've heard, that you have a drug problem, then you focus on the drug. And we have a lot with cannabis, for example, and then a pandemic, this was quite exacerbated. But usually, as Owen was saying, there's an underlying issue. And when we focus entirely on the drug, we're probably missing other coping issues. And what we see with some people is that at a point in time, drugs might even have saved them from more extreme situations. And we had one or another person reporting that they were feeling so bad and with such low self-esteem, eventually thinking of self-harm. And in a point in time, drug consumption just helped ease some type of pain. And it was a way of them to reach the services. And sometimes when they reach us and we see that drug is not the issue, then you can refer them somewhere. And I'm not saying there's not an issue with drug use, but that sometimes we focus too much on the substance and not on the person. And it's really important to have a person-centered issue, because young people are dealing with a lot of things. And then when we start talking to them, we see there's a violent home, there's a problem at school, there's employment, which now it's an issue. A lot of people that are coming to us with what we can understand as a problematic stimulant use, when you start analyzing that, you see that they have a really difficult day. They commute to work, it's really far, they sleep very little, everything. So they start using stimulants to cope with their life, because otherwise they can't manage it. And we see like this increase, particularly on young women, for example, which is not adolescents, but with small children not sleeping enough. And you see, how can I dangle all of this? And what happens is I'm using a stimulant, sometimes even prescription, because it's what helps me deal with this. So at least this is what we're seeing a bit in our service. The drugs are important, but I think the lifestyle here really needs to be addressed somehow.
Monica,
I take the opportunity to say just one thing. In the chat, there are people presenting their cases. We cannot, of course, provide any comments on individual situations. We take it as a sign that we address the right topic. And there are a few questions for Owen from parents. If you can expand a little bit how to answer direct questions about parents' experiences. What should they? I know that is difficult because every case is different, but because there are many of this type of questions, I like to turn it to you.
So I think the question that a child will ask in the drug conversation will be, Mummy, Daddy, Mum, Dad, have you taken drugs yourself? Have you ever tried them? Now, the answer to that obviously depends a bit on whether the parent has or not. So some parents will just say, well, no, I've never tried drugs, and that's that. But for a parent who has tried drugs, they've got to then think carefully. And this is why I suggest people think about it beforehand. Because if your child is maybe 10, 11, 12, it might be quite confusing for them to hear that the parent has used drugs. For a slightly older child, it might be a very, very good way into a really important conversation about drug use, and to be able to talk about the parent's experience and what was good and what was not good about it. And so I think it's impossible to give a straight answer for every situation. I think you've got to think about how your child is going to receive the information and what's going to be most useful for your child. But the key thing is to prepare, because parents sometimes just don't prepare. Then they get caught out, and children are very, very good at noticing when their parents are caught out, and you don't want that. So prepare the question and your answer in advance.
Thank you very much. There was another question for Helena from a PhD student asking, because you mentioned that you find creative ways of communicating around substances. And this student asked, what can you do to correct the information, sometimes very aggressive informations that are available on the social networks, for example, that reach out young people quite directly?
What we have realized, and obviously this is a very challenging thing, health communication and how to communicate with people and how they understand, for example, drug alerts, how they understand the harm reduction information that we presented. And I know there's a lot of research about it. I even see people here in the chat that have more experience on this than me. But what I would say is that it's the trusting relationship that we build with people. I think it's what's the game changer on how people value or not the type of information that we tell them. And when we tell them that something that they share with us, we believe it's not true, or it's not like that, and this has to be carefully put. but I think this is built after a trustworthy relationship. For example, what we realized from people that are reaching our psychological support place or even us at festivals is that usually nowadays, this changed in the last years, people know us previously from social media, particularly from Instagram. And they said, oh, when someone told me about you, I followed you, the organization, for a while on Instagram before reaching out, because they were trying to understand what type of communication you were having. What's your position on drugs? What do you say? So before coming to our drop-in center or coming to meet us, people already have an idea what to expect and how are they going to feel, whether they're going to feel judged or not to present a certain behavior or talk about something. So again, and I think probably with parents, it's the same, obviously, but it's a different relationship. But I think it has to do on how you build relationship. And we try to be evidence-based and objective in the type of information that we have and engage in people, whether it's some more prohibitionist or less. We try to have I don't think you can have a neutral conversation in terms of drugs, but at least science-based and be able to discuss with people from their point of view. And I think we've reached that point where a lot of people trust us and trust what we say.
Thank you, Helena. There is a comment I like to report because I think it builds on what was said, and after I probably will pass the floor to our director, because there are many questions. As always, we are not able to answer all the questions, but we keep track of them and we try to send them to the speakers. And this comment by Rick Brennan saying there is good quality information is crucial. However, we know from the kids they met in therapy that many children are very well informed about the dangers of drugs, but this is not one of the reasons for them stopping or being more cautious. The idea is to help them to build competencies to handle and to manage in their life in a healthy and safe way. So I think it to some extent summarizes what we were saying here before about how to reach them properly without just putting forward scary strategies that cannot be effective. I know that everybody will be a little bit disappointed because there are thousands of very interesting questions, but we need to move forward. We probably will keep other webinars, and I would ask Alexis to try to synthesize and give his always illuminating conclusions from our conversation. Thank you very much.
Well, thank you. I think you are too positive about me. I think what was enlightening was certainly the presentation from the colleagues from Nakisa and their colleague from Helena, from Owen. By the way, I'm extremely happy to see all of you. Maybe in particular Owen, because as we have been cut from the UK because of Brexit, which is a real pain for us almost every day. And also we have, I imagine that Nakisa may be coming from the UK or for at least in English-speaking country. So, so happy to have you all of there. I think the presentations and the questions, they were very stimulating. I certainly don't have the arrogance to pretend summarize it in 2 minutes. I would like to share a few highlights and a few ideas. First is, as you say, I really welcome also the proposal by Marika, Alessandra, and the colleagues. Of course, I don't forget to thank Raquel, who accepted to chair this session. Because I think working with adolescents is key, and I think we don't speak enough about this. We speak about a lot of things, but we are living in a world where more and more you can speak about plenty of things, and actually you don't say really anything. Or that's a way to speak about things with no impact, no. So when we speak about all those changes in the drug situation, well, I think a challenge for all of us is to say, okay, but what are the conclusions? What is it that we can propose? Because we talk about our citizens, and for the topic today, as I said also in the interview on TV5 Monde, I mean, we talk about our children. So let's stop about this story only talking about war against drugs. We have different problems. We have different challenges. Yes, we need to fight drug trafficking. Yes, of course. But this expression war on drugs and the negative consequences that are just channeled through the message for prevention, treatment, and so on, I think it's really time to look at this differently. First of all, because it was also highlighted in some of the comments made by Owen. It's true that there is a lot of misinformation of the teenagers, the adolescents, but also misinformation of the adults. And I think part of it is because there is too much stigmatizing discourse circulating everywhere about drugs, like we are still 25 years ago. I think given the huge changes in the situation, how many substances we have, all the things we have learned, we cannot continue to talk about drugs as we did 25 or 30 years ago, which is even in the schools sometimes quite repressive, rejecting those who have been found consuming drugs. And I imagine that still today for some school directors, it's not very easy for them to acknowledge there is a problem in the school because it could be bad for the reputation. So I think we have a lot of effort of explanation and supporting also the better qualification and evidence-based education in all EU member states, because Owen mentioned also destigmatizing. I mean, if the only discourse about drugs is a stigmatizing one, is depicting any person using any kind of substance like falling in the cliff or in the vertigo of drugs forever. I mean, even when I was a teenager, we know that some of those comments were just not true. And what was said by the different speakers this morning also is the importance of trust and how to build trust with our teenagers and with our children in general, more generally. So I like very much the comment made by Owen regarding honesty. I think honesty is important. But can we say everything to everyone at the same time? No. So the thing I really appreciate the comment made by Owen. Again, if you have a child that is 8 years old, you are not supposed to explain all the things you have done, all the risk behavior when you have your first relationship, sexual intercourse without condoms, because I mean they are too young. So you need to choose what it means to be honest, but to change the content of your testimony according to the age to what may be the implicit message. So I think that's and just for Owen information, with the new mandate of the EMCDDA, we are not going to work only on alcohol, but certainly we will have a broader mandate to police substance use that will also at least encompass alcohol. Now, another group of, yes, and talking about the services for adolescents, it just happened that the last 8 weeks, I was invited for the opening of 2 programs for adolescents. One was in Brussels with a new program from Enaden, and another one that is open in Thessaloniki in Greece. I think it's really important that the public authorities include this and more in the future for their programs. There are general programs of mental health, and the comments made by Helena and Nakisa and colleagues show that we need to pay more attention to a better integration of the different health initiatives. And this means that in some case, we need also to change the training for the professional in mental health, because the idea that some of them have about addictions should be a bit updated based on facts and reality. And this is why there are some interesting masters in addictions that are offered by some universities in some countries. That's very important. I think what we learned from drug checking and from the program for the webinar today, I'm continue to follow a bit the topics in the discussion, is also with the drug checking. I think we are at a very important moment for many reasons in Europe, but an important moment also is we need to decide, are we going to continue to build on the lessons learned of the changes in drug policy the last 30 years, or are we going to go backwards? And that's a question EMCDDA or EUDA will not be able to answer. But still, we have more participation of people who are using drugs, more involvement. Is it enough? Probably not. But compared with other countries or other regions of the world, it is different. There have been significant changes. We need to build on that. And I think, for instance, the initiative of drug checking in festivals, there are different modalities going from, from harm reduction interventions to law enforcement interventions. I will not comment, but it's about being honest, realistic, and pragmatic. And I'm very happy that we are making progress towards the publication of a joint publication together with the TEDdy network of drug checking programs about risk communication, building on the experience. We are not going to pretend to tell the drug checking what they have to do, but learning from their experience, what are the outlines of what can be considered as a minimum best practice and that could be useful and replicable for others. And as there was a question about the early warning system, how to improve it in Europe, well, we need to articulate even better when needed and when feasible, and if not yet the case, with programs like Kosmicare, but also drug consumption rooms and other initiatives. And then we have a special focus at EMCDDA that we consider for the new mandate of the agency is the music festivals. We have in some member states, like in Belgium, there is a cooperation between the Belgian focal points and Tomorrowland. We have been invited by the Minister of Interior of Belgium, Annelies Verlinden, to have also a closer contact and cooperation with Tomorrowland in the future. So I think that's important because, as it was explained by Helena, to stand together with the teenagers, the adolescents, and to answer the questions is not only just about making a check of the content, it's the counseling, is the fact that if they don't feel well after consuming, there is a place where they can ask for help or assistance. That's extremely important. And that's also, there is not yet enough consensus about the need. And also one of the last comment from Helena that I keep, because I think it's valid for all of us, is the need, and in the discourse to the parents, is also need to focus on the persons, not on drugs. And the explanation of Owen was really, the presentation from Owen was very interesting, because I mean, in some cases, if a teenager say, yes, I've been using, say, oh, we have a drug addict in the house. Well, maybe we have. And then what to do, where can we get help is, of course, important. But I had to answer to some journalists a few weeks ago that someone who uses drugs is not automatically becoming a completely junkie or drug addict. So the more substances, the more opportunities, and this is why we speak about everywhere, everything, everyone, is that when we understand that everyone can be confronted at a moment in his or her life or their life on a short or more chronic addictive behavior, well, they are still humans. They don't transform themselves automatically in a different kind of person that automatically lose the quality of being treated as a human being. So I think we need to update, and also the knowledge and the discourse on drugs, or in some cases I prefer to speak about substances abuse because there are so many. It's not a question, what I'm saying now is not a question about prohibiting or deprohibiting, because it's not the topic for today. So don't transform what I said in what I have not said. But even so, the discourse, the understanding that the health and mental health professionals or people who are the educators in the schools, we need to help them understand how much it has changed, and that maybe, as Owen explained in his presentation, in some cases, well, before to call the police, maybe to try and understand what happens with this consumption. Is this something that the child or the adolescent wants to continue or not? Is she or he aware of the risk, and so on? Because there are so many substances, we need to adjust taking into account the substance. And before to finish, the role of the substance, I think I may be wrong, and if Helena, Nakisa, her colleague, or Owen disagree, please say it, or Raquel. But what I remember is when I started working on the drug field 35 years ago, at least, there was a discourse that there is only one prevention, and that the prevention should not be specific in function of the substances. Well, today I'm not so sure, because sometimes some substances, they are really dangerous, or they are really potential risk, or there is more exposure. So to have just one discourse that would fit all purposes, well, personally, I don't think that's the correct approach. I mentioned the huge importance of mental health, and I find during the COVID pandemic and today with the economic crisis following the pandemic, but also the invasion of Ukraine by Russia and the war that is following and all the consequences, not only for the Ukrainians. I think the overall mental health of the youth is underestimated, including in the general population. So we cannot just have one thing that we don't want people to be drug addicts, but if they suffer and they are just about to commit suicide, we don't care because this is allowed, or this is not something for which we have foreseen a strategy or money. I think we need to be more comprehensive and more integrated. If not, we may end up and miss what is the objective. And then I would finish to congratulate the speakers, also those of the previous webinar. I think it's important to help parents to adapt and improve their parenting skills. I think many parents, and there are some testimonies in the chat, I think a lot of parents felt or feel quite alone. And they may feel that they don't feel really competent. They don't know exactly how to manage what to do. And some parents, because of their family history, that's a family therapist in me who's speaking, they've not acquired from their own experience what means a positive or constructive parenting skill. So instead of stigmatizing or conveying only negative message, and again, I love the table presented by Owen, because that's what we were saying already 30 years ago, the official discourse. Watch your child, because maybe he's not speaking with others, staying in his room all the night and speaking only with friends. Okay, if those are the only criteria, maybe we diagnose all teenagers with having a problem with drugs. So again, this supporting, strengthening, and therefore we need also to destigmatize the parents. I think there is a tendency when we speak about protective factors or negative factors, there is a risk, I think, that we may say, okay, those who have a problem with substance use, they had the sexual abuse, they had the trauma. Well, actually, I know plenty of good parents or parents who do the best they can. And in some families, there is someone with the problem of substance use or abuse. In other, there is no problem. I think we all our families, starting with ourselves, if we are lucky enough to have no problem whatsoever, is to think that, in fact, we are very lucky. We are not better parents than the others, and the others, they are not worse parents. I think if we want to build and strengthen the capacity of the parents, we need to understand they do their best in most of the cases. And we need to try to help them to do even better and to cope with a lot of questions and uncertainties. And I think today we had interesting testimonies from different perspectives that it's important to learn from how look like the real world today if we want to be really helpful for our adolescents. And the ultimate goal is to build or to keep trust with them. And if they feel they can speak with us about their use or their abuse, certainly that's the best guarantee we can have to try to find a way to help them. If they feel excluded or if they don't feel at ease because you look at them like that and trying to see what is the deviance that they are experiencing for the moment, you lose yourself as the first resource for your children. Maybe we can all learn to become a better resource for our children, but that would be, for me, one of the good steps in the better direction. So this was not a summary. I tried not to reinvent another webinar. This is what crossed my mind listening to the different speakers. And again, I want to thank you all for your strong participation to the EMCDDA webinars. And I give the floor back to Raquel and to Marika.
Thank you very much, Alexis. Always very inspiring. I don't add anything because it's impossible to add to your words. Just to say that in the chat, we receive a lot of congratulations, even individual congratulations and thank yous from people who feel reflected in their needs in these webinars. And there are also requests for more webinars on this topic, meaning that we will, Alessandra and I will bother you more. Just to say that Raquel disappeared at a certain point because she had a technical problem. So this is why I entered into there is a big team working behind the scenes of these webinars, and we are always available for substituting each other. I thank you all the speakers, and I will launch a poll. You don't need to stay. I will just leave the time to the people to answer this poll, to say to us if it was nice, if we can improve something, and more importantly, if they want a certificate, we can prepare certificates for them, for their participation. Thank you, everybody. See you soon.